Welcome to JoyMed Podcast, brought to you by SafeHaven, a program of the Medical Society of Virginia. I'm Melina Davis, your host. I'm the CEO and EVP of the Medical Society of Virginia. We're thrilled to announce the launch of this new podcast series, where we'll delve deeper into the challenges faced by healthcare professionals, explore strategies for resilience, and highlight the support systems available to them. Each episode will feature expert insights, personal narratives, and practical tools to help foster a healthier, more supportive environment for our healthcare heroes. Make sure to subscribe to our podcast so you don't miss this important series, and share it with your friends and colleagues. Together, we can create a culture of care and support, ensuring that those who care for us are cared for as well. Thank you for listening, and we look forward to continuing this journey with you. Welcome to JoyMed, the podcast hosted by SafeHaven, which is part of the Medical Society of Virginia. I'm your host, Melina Davis. I'm thrilled today to have a guest here, Bobby Cockrum, who's PAC and incoming Virginia Academy of PA's president. And he's also Assistant Vice President of Advanced Practice Providers for Inova Health Systems. We're hoping to explore sort of the frontline experience of nursing, PAs, and burnout. So welcome, Bobby. Glad to have you with us.
Thank you. I appreciate the opportunity.
Yeah. So you and I have spent a little bit of time together, but I want to get to know you a little bit. Tell me a little bit about your background and how you became a PA.
Yeah, so I've always been interested in medicine. I was volunteered on a local rescue squad when I was in high school, so I was an EMT. Also did some search and rescue stuff when I was in high school as well.
Wow.
You know, was kind of on that track pretty early on. Went to Virginia Tech, graduated with biology and chemistry, and then decided to go to PA school.
So you don't do anything light. It sounds like you just dive right in.
I like to dive right in. Let's get it done.
I like it. What is it that makes your job special?
So, you know, as a PA, I think it is such a unique role in healthcare, and that we get the opportunity to obviously treat patients, work very closely with patients, but we also have the opportunity to I think, connect with patients on a little different level as well, which really, I think, helps improve the patient experience all the way around.
Yeah. I've actually had a very personal experience with a friend's mom where a PA really made the difference in her care. She really was the glue between a lot of the members.
Right.
Communication, insights, questions. Yeah, it's a very special profession.
Yeah.
What's a day like for you? Well, walk me through a day.
So in my current role, I'm about 95% administrative. So I lead all of the APPs for Inova Health System.
That's a big job.
So I have a lot of strategy meetings, planning, things like that throughout my day. But from a clinical standpoint, I still do practice clinically, usually 2 to 3 days a month, shifts a month in critical care. And the day is very atypical. So in critical care, you just sort of deal with whatever comes your way. So it's obviously inpatient. We have shifts that are float shifts where we do all the consults, admissions. We do all of the emergent consults, that were called MSETs. So if people are having, cardiac arrest, respiratory arrest, things like that. And so my day really is dealing with those issues kind of throughout the day. And it is certainly a team approach to it. So we have physicians and APPs that work together. We tackle the day as it comes to us. So,
were you drawn to critical care because of your background?
Yes, absolutely.
Pre-college?
Yeah, absolutely. Always really enjoyed the intensity.
Yeah.
Definitely.
Does the stress get to you?
It does. It definitely gets to you.
I bet.
Yeah. I mean, it's it's a very stressful environment in general. I mean, you never know what is coming, and you're dealing with patients that are very sick.
Yeah.
It can be a very, very stressful, very tough environment. It's very intense. We usually have a lot of patients that we touch each day.
Wow.
So yeah, it's very stressful.
You seem like you have a very calm demeanor in general. Is that your personality?
That's what everybody tells me.
Yeah. You seem chill, I have to tell you.
I try to be pretty chill.
Critical care and chill, I would imagine, go hand in hand very well.
I think you have to be that way.
Yeah.
If you're not the chill person in the room, then things don't go well.
Right. Well, and somebody needs to be in that moment,
Yeah.
right?
Yeah.
That's great.
Yeah.
And you have a big job. I mean, how many APPs are at Inova Health System?
So we have a little over 800 employed APPs right now, and probably another 700 or so that have privileges there. So in total, about 1,500 APPs. Yeah,
that's immense.
Yeah, it's huge.
So you have a unique perspective. You get to see a lot of people's experiences. What do you think the state of burnout is among your APPs at this point?
It's been a tough few years, right? I think COVID really accelerated burnout for APPs, physicians, nurses, kind of the whole team. And we saw a lot of APPs leave practice around COVID, and it's been, slow to recover from that. I think that fortunately there is more and more focus on burnout, and, health systems and organizations like MSV are really helping to bring that to light, and provide resources for providers that otherwise have not been there. So I think it's getting better because there's more focus on it, but it's still significant.
It's heavy every day, isn't it?
Absolutely.
Yeah.
Yeah.
Can you share any stories of what you've seen as you've worked with folks?
And when I think about burnout, I go back to COVID. I had, during that period of time, I worked 6 to 7 days a week for about a year.
It was incredible then, wasn't it?
It was crazy. And obviously in the ICUs, so dealing with the sickest of the sick patients. And I remember when it all started, we had a lot of strategy meetings up to when we got our first patients. And many of the strategy meetings, the feeling was that we were going to have to deal with this for a few weeks, maybe a month or so, and then we'll be able to put this behind us.
Yeah.
And I remember when we started getting our first patients in, and things really started ramping up. I was on one of the float shifts where we were doing all the admissions and dealing with all of the cardiac arrest, respiratory arrest patients, and I remember being in the hallway, and we were getting called to multiple rooms at the same time. Nurses were calling us and saying...
In the same instant?
Yeah, same instant. And we had one guy that I remember going in and seeing, he was having a really, really horrible time breathing, and we were going to have to put him to sleep, intubate him, put him on a ventilator. He was very upset and saying, I know I'm not going to make it. Can I please call my wife? I just want to call my wife before you put me to sleep. And, he was not in a state to be able to really talk to his wife, and was critical. I mean, we needed to put him to sleep pretty quick. And, but we did pause for a moment. We let him call his wife really quick.
Wow.
And then put him to sleep. He died a few hours later.
I feel the weight of that.
Yeah. And I remember coming out of that room, and as we walked out of that room, we had nurses in 2 different areas that were yelling for us because there were patients that were crashing. And so when I think of burnout, I immediately go back to that.
At that
I
moment.
literally paused in the hallway after that experience, and I thought, this is a war zone. This is unbelievable. And I'm not sure we're going to be able to get out of this.
Yeah.
That was my thought at that time.
That was your first sort of realization, we're not going to be here a couple of weeks.
Yeah.
You know, it's so interesting. I don't know that most people in America know this, but I've done enough reading and research now because of SafeHaven to realize that healthcare is one of the most dangerous professions that you can be part of.
Yeah.
And we are comfortable with the idea and normalize the idea that PTSD is part of being in the military or firefighters or police. But I don't know that we think about that for people in healthcare. And what you describe right there makes me automatically think, and that you hearken back to that moment.
Yeah.
That feels to me like a trauma response.
Absolutely. I 100% agree with you.
Yeah.
And, that's one example.
Yeah.
I mean, there are so many stories that I think any healthcare provider could tell you, physician, APP, nurse, about experiences like this that will stick with them for the rest of their life.
Because it doesn't just, we all wanted to normalize and get back to life as it was.
Right.
I think.
Right.
And somebody just give me normal, right? Again. But that stuff, it sticks inside even when it feels normal every day.
Right. And we're all human. I mean, anybody that goes through experiences like that, it makes an impact on you. So absolutely.
Yeah. Do you think it's affected you in your day-to-day life, having that with you?
No, I don't think so. I think I've been able to handle it well.
Nice.
My family is extremely supportive.
That helps, doesn't it?
And absolutely. And my organization has been very, very supportive as well. So
that's good.
I think I've dealt with it well, but I don't think many people that are outside of healthcare recognize these kind of incidents that people have to live through.
I know that when my family and I have gone into a hospital setting and had a very harrowing experience, we think about the nurses, the doctors, the PAs after and how important they were to us. But I don't know that we think they remember us and the moment that happened with us and how that affected them and their psyche and their life. Yeah. Right? But that's normal, right?
Yeah, absolutely. That's what I mean. We're all human. So, when you have an incident that really affects you, if you're a patient and it really affects you, there's people that are taking care of you. They're watching you go through this, and they're affected by it.
They're affected, even though they have to be professional and put you first.
They're professional, and you do. When you go into medicine, you're kind of taught this. You do have to detach yourself a little bit from. But that's difficult because most of us went into healthcare because we want to take care of people.
Because you care.
We care about people, and we really enjoy helping people.
Right.
But it's tough to detach yourself from patients, and because you can't detach yourself, those things stick with you. They're an impact.
Yeah. As a patient, you don't sort of put yourself in the person's shoes that. Is there helping you because you're not in a position to do that, right? But I know that patients are grateful for that care. When you are going through burnout today, post-COVID, we're, a couple years past, what's burnout like today around you?
Yeah, I think that we still deal with a lot of the same issues. Obviously, we're still dealing with patients and those experiences. Yeah. But, I think burnout now is difficult for a number of different reasons. You've got so many different factors like the pressure that's on providers to provide access to patients. There are more and more focus on quality. So many quality metrics. So the care you're delivering is scrutinized even more. Patients are more complicated. So we're getting better and better at dealing with things as an outpatient. And so sometimes when people come to the hospital, they're further along in their disease process. And that may be because also they just don't have the access.
Yes.
So going back to my other comment. But so patients are more complicated. They bring a lot of social issues with them. There's mental health issues that the patients obviously have and bring with them. There's social issues that they bring with them. And so I think, all of those things really combine to really exacerbate burnout for healthcare providers as well.
And you're seeing people at not their best moments.
Absolutely.
Right. In fact, many their worst days.
Their worst moments. Right.
So if any of those conditions they brought with them into the situation, they're not managing them as well as they might in another situation. Right. Just to go back to the earlier comment about people having left healthcare post-COVID, I know we're recovering a little bit in that, but is this the main reason for access problems in your opinion?
Yeah, I mean, so we are recovering to some degree. I mean, we saw a lot of people leave healthcare back when COVID happened. We've slowly seen even, some nurses and PAs and physicians that left for a period of time, start to come back, which does help with access.
Yes.
But, I mean, I can confidently say from what I see on a day-to-day basis in working in my current position that we can't add healthcare providers fast enough to be able to support the needs that the patients have.
Yes.
And so, again, that's another thing that sort of exacerbates burnout for providers because we're perpetually working short.
Right. It's an interesting way to put it. And under increasing stress.
Increasing stress and working short.
Yeah. And what about administrative burden? How weighty is that in the burnout process for PAs?
You mean in my current role or administrative day-to-day?
Yeah, either, both.
Yeah, I mean, so, it used to be when you saw a patient, we had paper notes and you just kind of wrote a little bit and it wasn't really that, scrutinized. But now we have electronic medical records. We spend a lot of time making sure that we have, exactly the right information in the patient's chart. There's a lot of scrutiny on electronic medical records from a billing standpoint. Patients have access to electronic medical records. So people spend a lot of time making sure that they're documenting what needs to be documented in electronic medical records. And so it's an important point because you think it's not just taking care of the patient. It's dealing with those issues as well. So
Yeah. And it's not why you got into it.
It's not why you got into it at all. At all. That's right. Yeah.
Any relief from that, do you see?
I mean, I think that I'm very hopeful that technology with AI and some of the advances that come along with that are really going to help us out with our documentation and the whole burden around electronic medical records.
Let's hope.
We also have, patients take advantage of some of the electronic medical records features like my chart and their ability to send chats to providers or ask questions. And so technological advancements with AI and such are going to help us manage those as well. So I am hopeful that we're going to see more and more relief with that. Yeah.
Do PAs have pajama time after work?
Absolutely.
Yes.
Absolutely. Yeah.
I don't know that most patients know that you all, after work, after dinner, when your family goes to bed, sit there and still have to work and get all this done, right?
Yeah. Yeah. No, that's so I think what a lot of patients don't realize is that PAs really have a very similar role and function to your physician.
Right.
And so we're doing the exact same things. And many of us have our own patient panels that we take care of. And so we are your primary care provider in many instances. And so the burdens that physicians have with pajama time and, call and orders and all those kind of things, they're all the same. We have those same burdens as well.
Yeah. And how do you think SafeHaven can help or is helping people?
SafeHaven is wonderful. I think that having the opportunity to be able to have a service that you can reach out to if you need help, counseling help or whatever that might be, to help you deal with burnout and to help you deal with some of those experiences that you'll inevitably have as a provider, I think are just incredible, incredible opportunities. So also knowing that it is a confidential way for a healthcare provider to seek that sort of help is extremely important because many would never reach out otherwise.
What do you think the barriers are that make that confidentiality so important? Why is confidentiality?
Well, I mean, so, as a provider, you go through a pretty extensive process to be able to gain your license and your privileging. And there are background checks to make sure that you're safe to be able to deliver care to patients. But as part of that process, unfortunately, many mental health issues are scrutinized to a degree where providers feel like they can't seek help.
Even just for stress.
For stress, just for
a difficult day.
That's right. Right.
Yeah.
And that's unfortunate because it really should not be that way. And SafeHaven helps to remove that barrier.
Yeah. And how important do you think it is that SafeHaven is available to the entire clinical team? Do you think that makes a difference?
I think it absolutely makes a difference. I think, the example that I shared earlier, I mean, everybody's taking care of that patient. It's not just the physician. It's not just the PA, the nurses, the techs, respiratory therapists. It is very important for the whole team to have that opportunity to be able to seek that assistance if they need it.
Now, one thing about SafeHaven that's special is that it's voluntary.
Yes.
It's something you choose to do. It's not something somebody makes you do.
Right.
Right. And do you think that peers are more likely now or the same likelihood to recommend? You should call. You should feel comfortable. Do you think we're at all yet normalizing getting help?
Yeah, I think we are definitely helping to normalize this process. As we see more and more opportunities present like SafeHaven, it definitely helps colleagues feel like this is okay.
Right.
And feel, when they see that their colleagues having a rough day or having a hard time dealing with a particular situation, makes it a whole lot easier for them to say, hey, you know what? You should give them a call.
Feel free.
Yeah, feel free. Yeah.
How do you think SafeHaven encourages people to get help compared to, say, what just an employer EAP would do? Do you think there's a difference?
I think that, having something that is independent is another resource that's really important. I will say, our organization does a great job really supporting our providers, and there are multiple different ways, but having something that is independent from your employer, I think people feel more comfortable seeking out something like that.
Yeah, that's what we've heard too. Yeah. I do know that your health system, Inova Health System, is very pro-wellness and really cares and has invested a lot.
Very, very great in that space. So.
Yeah. We see, a real movement in hospital administrators really understanding how important this is to the health and wellness of their workforce.
Yes, absolutely. Yeah.
And that's important for breaking the stigma and normalizing it.
It is. And Inova does a wonderful job with it. And they've made strides in really developing new ways that employees can seek help if they need it.
Yeah.
And it's great. They do a wonderful job with it.
If you could wish for one thing for PAs as they move forward, or if SafeHaven moves forward, what would you hope would happen to make your profession healthier, or the conditions that you work in healthier?
I think the team-based approach and mindset to care delivery is so important. And I would love to see the barriers broken down between physician and APPs, PAs,
yes,
and how we can work together to really improve access, provide the best care that we can for our patients. And I think that, that would be the one thing I would wish for, is that we could truly work together and put differences and training, education, things like that behind us to really understand that we're here to deliver the best care for the patient, and let's see how we can do that.
We've been so lucky in Virginia to enjoy such a strong partnership between
Yes.
your organization and
Absolutely.
the Medical Society.
Yes.
And not every state enjoys that. I think
No.
we all feel very grateful for that partnership.
Yeah, no, I very much appreciate the partnership between Medical Society of Virginia and PAs here
We
in
do,
Virginia. It's been tremendous, and I think it makes a big difference in breaking down those barriers.
I think so. And I think we continue to challenge those and challenge each other, which I think is positive. And in fact, you all are full members now of the Medical Society, which I know everybody is excited about what that means.
Yeah.
I think we're excited about your year as president, and I'm just grateful that you've spent time today and all your advocacy for your profession. Thank you for your service.
Yeah, absolutely. No, I appreciate the opportunity, and I think this is such a great thing to talk about. And the more we talk about it, the more we normalize it, and the more people will seek the help that they need.
I agree. Thanks for being with us.
Thank you so much.
All right. Thanks, Bobby. Thank you for listening to Joy Med, a podcast series I think you'll find very interesting and compelling, all dedicated to making our healthcare workforce healthier. Come back and hear us soon.